The heading of this talk is When the World System Fails, What Do We Do in Connection with Pregnancy and Birth? Okay, there's no hospitals, no staff, no electricity, no internet, no medicine, no ultrasound, and so forth. For a long time, the human race have rejected common sense, logical thinking, and creation as made by God. Instead, they have adopted evolution, lifting themselves up to a position of ultimate authority, rejecting God outrightly, usurping God's authority, and misleading many. And we have been misled. Isaiah 4 verse 6 says, My people are destroyed for lack of knowledge. Because thou hast rejected knowledge, I will also reject thee, that thou shalt be no priest to me, seeing thou hast forgotten the law of thy God. I will also forget thy children. Proverbs 1 verse 7 says, The fear of the Lord is the beginning of knowledge, but fools despise wisdom and instruction. My name is Tessa. I would like to make it clear that I am not a doctor, I am not a nurse, I am not a midwife. All the information that I'm going to give is information that is self-taught via the internet and my own experiences. Let's begin. To clean the mind of ideas that have been taught us concerning pregnancy, labor, birth, and womanhood itself is going to be difficult. But when the system we know so well fails and anarchy breaks out, we will have no choice but to trust in God and to put our faith in Him who has made us. Let's look at some questions/fears women would have in case of pregnancy and birth during chaos and instability. No ultrasound machines. How are we going to know what's happening inside there? Well, they used to use x-rays to see what's happening inside there before they knew much. Women wanted to see the skeleton of their baby. So they took an x-ray and they said, oh look, oh nice little skeleton, woo. But it was dangerous for the baby, as we know now. So they reverted to ultrasound, which is a much lower form of radiation, but not enough studies have been done concerning the dangers to the fetus using ultrasound. And some women may have 12 ultrasounds throughout their pregnancy, and studies on animals have shown the outcome is not so nice. But more studies have to be done. But if chaos breaks out, there will be no machines. And do you know what? It's actually better that way. Everyone has the misconception that a baby must come at 40 weeks. It's not true. It's inaccurate. There is a wide space. 2 weeks before, 2 weeks after, even 3 weeks after 40 weeks is actually still normal. But people like to be in control of everything, and women want to know every little step. We are not supposed to know. God knows, and that's enough. We must be patient. When the baby is ready and our hormones are right and in place, then labor will start. If you haven't filled your body full of drugs and chemicals and things will go the way it should. You don't have to fear about that. Okay, I was with my son I was pregnant until 42 weeks, 5 days, and then went in for an induction because I didn't know much back then. That turned out horribly wrong, and I ended up with an emergency cesarean. My first daughter, I was 41 weeks and 4 days, and I went into spontaneous labor. It was a home birth, and that was wonderful. My second daughter was an unassisted birth, 42 weeks, 3 days. I didn't go and see the doctor once throughout that pregnancy. I went to do one ultrasound to see where the placenta was, to make sure that it's not over the cervix. And knowing that, I was quite happy. Oh, another thing about ultrasounds is that when they listen to the heartbeat, the longer they keep it there, the warmer that area gets, and that is dangerous. So it's better not to even listen to the heartbeat. You can see it on the ultrasound, see the heartbeat. Don't try and induce your own labor via medications, herbs and such. Be patient and trust in God. Every baby develops at its own pace. Isaiah chapter 66 says, "Before she travailed, she brought forth. Before her pain came, she was delivered of a man-child. Who hath heard such a thing? Who hath seen such things? Shall the earth be made to bring forth in one day, or shall a nation be born at once? For as soon as Zion travailed, she brought forth her children. Shall I bring to the birth, and not cause to bring forth, saith the Lord? Shall I cause to bring forth, and shut the womb, saith thy God? Ye of little faith." I have had a C-section. I can't have a normal birth. Many women, many women have had normal birth after a C-section, even 2 C-sections and then a normal birth, even 3 C-sections and a normal birth, and some women on YouTube have even had more. But no doctor will help them because of insurance, so they have to do it alone, and women have the power to go alone. It is more risky, actually, to have another C-section than to have a vaginal delivery after having a C-section. It's more risky to go for another C-section. Okay, to have a normal delivery after C-section has got a name. It's Vbac, vaginal birth after cesarean. So look it up if you want to. What if the baby is breech? Many doctors actually fear to do a breech delivery because they have never actually witnessed a breech delivery. Because of insurance and all that rigmarole, they just don't even think about it. They say immediately, C-section. They don't give you an option. They just say, right, theatre. But like many women out there who've just decided to go against the system, there have been plenty of women who have done it alone at home, delivering breech. The thing to remember with breech delivery is don't touch the baby. Let the baby come out by itself and the mother's contractions. Don't hasten or manipulate the baby. Positions is quite key in natural birth. Squatting or hands and knees are good positions. Just place something soft underneath the mother in case the baby comes out quicker than expected, and guide, but don't touch. Okay? The Psalms 139, 13 to 15 says, "For thou, O Lord, hast possessed my reins. Thou hast helped me from my mother's womb. I will give thee thanks, for thou art fearfully wondrous. Wondrous are thy works, and my soul knows it well. My bones which thou madest in secret were not hidden from thee, nor my substance in the lowest parts of the earth. So now I'd like to ask, thou hast helped me from my mother's womb. Was it the doctor has helped me from my mother's womb, or was it the midwife helped me from my mother's womb, or was it thee? It was God. The Lord helped David's mom give birth to him. So, who is supposed to help a woman give birth? Who is the ultimate midwife? It's not a human being. God knows everything that's happening inside there. You don't need to know everything. We can't know everything, but God does. You have to trust in Him and let things be, and pray that He has mercy on you during childbirth. What if I tear during childbirth? Must I have stitches? A natural tear heals a lot better and a lot quicker than if someone cut you. Think of it as bricks. Let's just draw a quick picture. Right, you tore like this, naturally. If you get cut, it will be like this. Which do you think will heal quicker? The body closes itself again. It wants to come back to the position that it was in before. How can it get back to that position if it's severed neatly? Lots of women who have been cut complain about pain there for years, or they say they've lost feeling. If you tear naturally, it will come back together again, and stronger than if it was cut. With my first daughter, I tore very badly, and it healed by itself. I didn't go in to the doctor for stitches or anything. With my second daughter, I tore again, about 3 centimeters, a different place, and it looked terrible. And I told my husband, I'm just going to leave it. I'm going to see what happens. And 10 days after that, I looked, and it had neatly come back together again. Without stitches. No stitches. In the old days, what do you think they did? Please, I need some stitches. Could you come over to my house? No. It healed by itself.